comes around. But now, they say we probably saved the best for last. I would really like to introduce Dr. Addy Disick. She's a member of the American College of Rheumatology, the National Osteoporosis Foundation, and the American Medical Association. But most of all, Dr. Dissick is a very warm and fibro-friendly doc who we are so grateful for all the time.
Thank you for having me. So my task today was to talk about clinical treatments in fibromyalgia. So this is a little bit tricky to try to cover in the time, so I want to just try to go through some things, and please stop me if you have any questions, and I will leave time as well for questions at the end. So some things, first of all, like we've already talked about, exercise and sleep are two critical components to treating fibromyalgia before we even talk about any medications or any therapies. So first off, sleep hygiene. So what that means is going to sleep in your bed, not doing anything else in your bed, such as reading or doing work, using your bed purely for sleep. Not drinking caffeine in the afternoons, not taking naps in the afternoons, like such as after 3 p.m., because that actually messes up your circadian rhythms. It makes it much more difficult for you to have a good night's sleep. Trying to go to sleep the same time every day and get up the same time every day. These are some basic, tenets that actually will help you to get a better night's sleep. Because one of the critical problems in fibromyalgia is non-restorative sleep. What that means is even despite getting 7 or 8 hours of sleep, you wake up feeling like you're not refreshed. Does anyone have that here? Non-restorative sleep? So that's usually the hallmark of fibromyalgia. So again, it's really critical that just following those basic tools first before even starting any type of medications. Then if you're doing all of those measures, the next step, if you're still not getting what I call restorative sleep, then medications can be started to help with restoration of sleep. Now there's a lot of sleeping medications out there, and I don't always recommend that you take a sleeping pill per se. So for instance, things like Ambien. Well, that helps you, and I'm not, supporting or against any particular medications, but for instance, Ambien is a sleeping pill, but it does nothing to restore sleep. Okay, so if your problem is falling asleep, but you feel restored when you get up, okay, then maybe Ambien is okay for you. But if, on the other hand, really the problem is that you don't have restorative sleep, which is, again, the problem in fibromyalgia, then that's probably not the best medication to help you to fall asleep or to stay asleep. And there's a whole slew of tools, some that are approved for fibromyalgia and some that are not, that work and need to be tweaked because some people respond to one thing, some people respond to another. And as you all know, some people have side effects from one medication, some have it from another. Some people can be on 5 milligrams, some can be on 30. Not everyone's the same, and so things need to be tailored to an individual. The next thing besides sleep is exercise. And I agree that, of course, if you're in pain, who wants to move? Nobody. Nobody wants to move. The critical importance of exercise is that it actually releases endorphins. And what endorphins are, a natural, feel-good, natural high. It actually winds up lowering your pain after you do exercise for a chronic period of time. So what that means is in time, you can actually reset your thermostat, which is turned way up, and actually change your pain threshold. Okay, so if a certain stimulus right now gives you pain level of a 4, after chronic exercise, that same pain stimulus may only give you a 2. And so in time, and again, we're not talking about a week or 2, in time, once you build up the exercise, that will help you to cope better with everyday tasks. and with flares of your fibromyalgia. And now when we say exercise, I agree that starting out slowly is critical. So I do agree that 5 minutes at the beginning, if you're not doing anything, and of any kind of exercise, anything, as long as you're moving, 5 minutes is the way you start. And you have to, if you're able to do a week of 5 minutes of, let's say, walking without feeling burnt out or in pain the next day, then yes, the next week you can add an additional 5 minutes, either at the same time or spread out. It doesn't have to be at the same time. So the goal is, over time, to build up to 20 or 30 minutes every day, and of aerobic exercise. So what aerobic exercise means is when you're, and this is what you're building up to, not where you start, but where you build up to, is actually breaking a sweat, bringing your heart rate up. And so, yes, stretching is very important, but the aerobic exercise is what actually releases those endorphins and helps to reset your thermostat. Okay, so stretching is critical for your muscles, and actually the breathing is excellent for relaxing your muscles and improving your anxiety and releasing some of that tension. But again, it's that aerobic exercise that really makes a difference in the long run. And it doesn't really matter what kind of exercise, as long as you like doing it, because you're not going to do something if you don't like it. I do agree that the pool is a great place to be because you're buoyant in the pool, you're a lot less weight, and so it's less stress on any of your joints. And if you have any types of arthritis as well, then certainly it's a lot easier on you, easier on your body. So the pool, especially if it's heated, is an excellent place to be. The warmth usually helps with the muscles to loosen them up, and swimming is great. I do find a lot of my patients really enjoy and get benefit from doing yoga, particularly with the breathing as well as stretching. And then some patients of mine also like Pilates, and they get some really good responses from those two types of exercises. Medication-wise, I don't have a formula that I use and say, okay, you have fibromyalgia, I'm going to give you A, B, and C, or X, Y, and Z. It doesn't work that way. It really depends on what else is going on. Do you also have untreated depression? Do you have anxiety? Most people with fibromyalgia do have some depression or some anxiety, but it's not necessarily the cause of the fibromyalgia, and that's a misunderstanding that a lot of people have. A lot of times it's actually a result of the fibromyalgia, not the cause. And that's a misunderstanding a lot of even physicians have. And that's important. Now, once you have it, it doesn't necessarily, I mean, it matters, but it doesn't matter which came first, but it does matter in just understanding for yourself that it's the fibromyalgia that you need to deal with, not always the depression or the anxiety. But what I will say is, if you do have depression or anxiety that's not being treated, then the fibromyalgia is not going to get better until that's treated as well. And so certainly seeing a psychotherapist, seeing a psychiatrist, or at least talking to your spouse or talking to a physician, that can be really helpful. Talking to somebody just who's not biased, so you can just talk some of the things that are going on in your head. Fibromyalgia support groups. That's certainly, so you know you're not the only one who has problems, and you know that you're not alone. And sometimes medications are helpful, again, to treat the depression or anxiety. There are some medications, as you probably know, that actually treat both depression, anxiety, and fibromyalgia.